Okay, and then just to mention, this is just kind of interesting. You can look at it. You don't need to memorize any of this. There's a golden age of microbiology where a lot of discoveries were made from the 1850s to early 1900s. And you can just kind of look through this. Just interesting to see what kind of things were discovered. You don't need to memorize any of that. Another big development in microbiology was the discovery that microorganisms caused infectious diseases. So before this was discovered, they used to think that infectious diseases were caused by things like supernatural forces. So like God was mad at you, that's why you got the flu. Or maybe it was a miasma that was making you sick. Miasma just means bad air. So back then, things were pretty smelly. So they didn't have garbage pickup or sewer systems. People just threw their sewage out in the gutters. So things really stunk because there was a lot of decaying stuff around. And so they thought that bad smelly air was what was making you sick. Or maybe your humors were imbalanced. Humors is a really old term for your body fluids. Your humors, there were 4 humors that they talked about. Your humors were your blood. They had black bile, yellow bile, and then phlegm, so stuff you would cough up. And so they would try to balance your humors. So they would do things like bloodletting or giving you enemas. And that obviously usually would not help you and probably would make you more sick or maybe even kill you. So not a good way to treat somebody. So this eventually was replaced with this idea of the germ theory of disease. And what this says is that microorganisms cause infectious diseases. How the germ theory of disease came about is that some scientists were starting to make some observations that microorganisms were causing infectious diseases. So you don't need to know any of these scientists at all. But one scientist showed that a disease in silkworms was caused by a fungus. And then another scientist showed that a water mold, which is related to algae, caused the great potato blight of Ireland. Louis Pasteur is back. He discovered more evidence for the germ theory of disease. He was interested in fermentation and discovered that the microorganisms yeast were the ones that carried out fermentation and were converting the sugars in grape juice into alcohol, which made the wine. He was also called upon by the wine industry to help them solve a problem with their wine, which was spoiling. He discovered that the bacteria that had contaminated the wine were converting the alcohol in the wine into acetic acid, which is vinegar, which would make the wine taste really sour and disgusting, and then they wouldn't be able to sell their wine. So he came up with a process of pasteurization where he would briefly heat up the wine to kill off the bacteria without destroying the flavor of the wine. So that's where pasteurization came from. So around this time in the 1860s, a British surgeon, Joseph Lister, was reading the papers that Louis Pasteur had published on his ideas on fermentation and his thoughts on how microorganisms could cause things to decompose and change. And Pasteur was thinking that, well, not only could these microorganisms cause things like wine to decompose and spoil, but maybe they could also be causing diseases. So Joseph Lister saw that and he's like, well, this is probably what's going on in my surgery patients, because at the time they had no aseptic technique at all. This was when surgery was very dirty. The dirtier the surgeon was, that was seen as a sign of respect, that you were a better surgeon. So they would not wash their hands. Instruments were not cleaned. Their clothes were just all bloody and gross, and that was seen as a sign of a really good surgeon, which was pretty horrific when we think about it today. So obviously you can imagine their rates of surgical infection were really high, and Lister was really tired of losing a lot of his patients to post-surgical infections. So in reading Pasteur's papers, he decided, well, I'm going to try some of Pasteur's idea, because Pasteur had mentioned, well, we can kill these microorganisms by filtering them out, heating things up, or using chemicals to kill them. So Lister's like, well, I can't use filters or heat on the patient's wounds, so let's apply chemicals. So he decided to use a chemical that was being used to clean sewers at the time. It's called carbolic acid, which we'll talk about later. So he started putting that on his patients' wounds, and also started having his other students in the hospital he worked at, and also himself, and washing their hands in this carbolic acid, washing the instruments in it. They even were spraying the air around the surgery room with the carbolic acid, because they knew that the microorganisms were in the air from Pasteur's experiments. And unfortunately, the carbolic acid was pretty irritating to breathe in, and also irritating to the tissue. But the carbolic acid did work in killing off the microorganisms and preventing infections after surgery. So his patients survived, and he developed aseptic technique for surgery, so we can thank him for that. So a lot of things are named after Lister, a lot of instruments, and even Listerine is named after Joseph Lister.